Welcome to the COBRA edition of Medicare in Minutes, a micro-learning series designed to help you understand the ins and outs of Medicare. The Consolidated Omnibus Budget Reconciliation Act of 1985, known commonly as COBRA, is a federal law mandating that employers with 20 or more employees allow members and their dependents to maintain health coverage for a period of time after they leave their employer group health plan. Members and their dependents are eligible for continuation of their coverage in a variety of circumstances, including the voluntary or involuntary loss of employment, a reduction in work hours, a transition between jobs, and following specific life events such as the death of a subscriber or a divorce. Individuals are generally eligible for 18 months of coverage under COBRA, but can receive up to 36 months of coverage under certain circumstances. Meet Action Ben the driver, his car COBRA, his sponsor, crew, and partner. Together, they are going to help us explore the different interactions between COBRA and Medicare. Let's head to the starting line. Generally, employers contribute a portion of the employee's premium, and the employee pays the rest. But in comparison, when electing COBRA, members are usually responsible for the premium in its entirety. This will probably cause the member to view this change as an increase in their premium, since they are now paying it in full, leading individuals to view COBRA as a costly coverage option. As in any situation with multiple payers, there are additional complexities individuals eligible for Medicare should consider when offered COBRA continuation coverage. Medicare always pays primary to COBRA. The only exception is made for those with end-stage renal disease. With ESRD, COBRA pays primary to Medicare for the first 30 months of the coordination of benefits period. Following 30 months, Medicare becomes the primary payer. Because COBRA is not considered insurance from active employment by the Centers for Medicare and Medicaid Services, Medicare-eligible individuals are not protected from late enrollment penalties simply because they are on COBRA the way they could be protected on an active employer plan if they delay Medicare Part A and or B enrollment. Therefore, regardless of how many months of COBRA individuals are offered, they should enroll in Parts A, B, and potentially D as soon as they are eligible to avoid coordination of benefit issues and late enrollment penalties. If a beneficiary's Medicare becomes effective on or before the day they elect COBRA coverage, they can continue COBRA coverage as well as have Medicare. This is true even if Part A benefits begin prior to the COBRA coverage and the beneficiary delayed the enrollment in Part B until later. The beneficiary will have 8 months, regardless of a voluntary or involuntary loss of their GHP, to enroll in Part B. In this case, the beneficiary would be responsible for both the COBRA premium as well as the premium for Part B. It's worth noting that if a beneficiary chooses to decline COBRA in favor of just Medicare, their spouse and or eligible dependents are also considered beneficiaries and may still elect COBRA coverage under their own contract. Most Medicare-eligible individuals will find carrying both Medicare and COBRA cost prohibitive. However, those with significant drug utilization may elect to maintain both for the benefit of their COBRA drug card. Another consideration for those who are Medicare eligible and facing a decision about COBRA is the status of the prescription drug coverage of their group plan. If they are enrolled in credible drug coverage, and thereby COBRA, they may wait until COBRA has been completely exhausted to elect Part D prescription drug coverage without incurring a Part D late enrollment penalty. The termination of COBRA coverage will constitute a special election period, enabling them to enroll in Part D. However, we must remember that the termination of COBRA does not create a special election period for Parts A and/or B. If a beneficiary chooses to delay their enrollment in Part A and/or B until after their COBRA ends, they may not only experience claim processing and coordination of benefit issues, but will also have to wait until the next general enrollment period, January 1st through March 31st, to enroll in Medicare. Individuals who elect Medicare during the general enrollment period will have effective coverage starting the month after their enrollment. Another scenario to consider involves individuals who become eligible for Medicare after they have elected COBRA. In this case, the individual is usually advised to enroll in Medicare during their initial enrollment period, and their COBRA benefits will generally come to an end. A spouse or dependents covered on COBRA would still be eligible to maintain the COBRA coverage, and it may be extended for up to 36 months because of the qualification for Medicare. Individuals facing decisions regarding the election of COBRA have many considerations. For those eligible for Medicare, enrolled in Medicare, or becoming eligible in the near future, these decisions can be even more complicated. Individual situations can vary significantly. While shopping for Medicare can be a nerve-wracking experience, you can take steps to prevent some of the stress associated with the interactions between COBRA and Medicare when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.